Vladislav Zhitny, School of Medicine, advisor Joshua Goldman, and Frank L. Stile. Conducting medical internships and distributing information during a pandemic, lens of a plastic surgery applicant. Vladislav Zhitny is a medical student at the Kerkorian School of Medicine. His research focus is in graduate medical education and clinical research. Vladislav's research journey began during the SARS-CoV-2 or COVID-19 pandemic, at the time when academic medical residency and training programs were faced with the task of en masse information dissemination to thousands of medical school and fellowship applicants. Vladislav holds the record as the School of Medicine's most prolific student researcher, with 18 publications across 9 academic medical journals. Outside of research, Vladislav is the founder of the American Medical Students Association at the School of Medicine and a member of the Clark County Medical Society, serving as a student representative. One of 30 voting delegates, he is responsible for introducing and passing the first student-led bill that addressed shortages of medical residencies in Nevada.
At some point in our lives, all of us had to apply for a job. Many jobs today require that you perform an internship. The process of going through the internship and applying for the job can be extremely stressful for the applicant. Employers often wonder what universal details, like the pay, job description, and the area that you're going to be living in should be listed. They often have consultants for that. Now imagine that to get that job, you have to go to school for at least 8 years. I'm talking about medical school training in the United States. At the end of medical school, the U.S. medical student graduates are expected to apply to their chosen specialty, termed residency, and perform internships prior to applying for the job. In the past, medical students had the opportunity to visit the training sites or simply visit the area. The COVID pandemic changed that trajectory. You no longer could visit the locale. How should such students be evaluated now, and what information should be disseminated in current or the future pandemics? Our research team decided to recommend permanent guidelines on how to conduct medical away internships and distribute information during a pandemic. Let's consider a perspective of a fourth-year medical student applying, let's say, into plastic surgery. It is internship time. As you can imagine, in medical specialties, especially in surgery, you really need to showcase your skills to prove that you're the right candidate for the job. By giving presentations on your patients and partaking in procedures in the operating room, you slowly build your reputation and earn the respect for being a good student doctor. But how do you do that during COVID-19 pandemic? We performed best practices research from existing virtual rotations, like in UC San Diego, to determine what is the best way for medical schools to conduct this kind of an internship model. We recommend the augmented web-based applicant experience called internship model. From the standpoint of program site, virtual rotations can have activities including observed patient interaction, suturing household items like a banana, lemons, or suturing kits, can provide a substitute for hands-on learning. But this, of course, has also its downsides. You're no longer in the operating room and are unable to understand the procedure step by step. From the standpoint of medical student, you can participate in things like virtual conferences, journal clubs, and research meetings. The downside is, of course, you cannot understand the resident and faculty dynamics in informal setting. But let's assume the best. Give it the benefit of the doubt. You have finally completed your internship. You're in the process of applying for the job, the residency. When you apply for a position, you apply to multiple sites and not just one place. You ideally would like to learn something about the job and the setting. An unprecedented emphasis was placed on web-based platforms to distribute information during COVID-19. Given what we saw with virtual internship model, we recognized that there was very little research when we examined previous studies. Similarly, little research existed on information dissemination to the medical school applicants. Our team conducted a database study by accessing the online platforms of 82 plastic surgery programs as listed by the NRMP, or National Residency Matching Program. We identified common topics or criteria of interest. Through previously published studies, there are about 15 items that any resident job applicant would like to know. Salary is of course one of them, but program job site descriptions, including list of current coworkers or residents, teaching faculty, and rotation schedule are also key. But an individual also would like to know about things like where the alumni of the residency go on to. Is it university or private practice setting after their training? Is there any participation in research in national meetings? Is there a virtual tour of life in the area? We found that not all programs for plastic surgery met these basic standards. Only about 80% of the programs had less than 75% of these items listed, and 27 had less than half of this information on their websites. Our recommendation to the programs is to disclose the number and types of procedures candidates will perform to determine their potential exposure. Descriptions about if a program uses a mentorship system and if they're getting their desired work-life balance. Information about how a prospective applicant can develop both their own research and teaching experience to determine if the program prepares them for a future job in academia. These are some very important things, and not just anyone, not just medical applicants, need a holistic understanding what they're getting into. COVID-19 was by far the most serious, but not the first pandemic that we have encountered. Spanish flu in 1918, H1N1 in 2009, an epidemic of Ebola in 2014, and we know there will be more to come. Our research establishes permanent guidelines in the setting of a viral pandemic on how to conduct a virtual away rotation and what information should be disseminated to the applicants via web-based platforms. Thank you for your time.